Okay, so coming to classification of drugs. So in this series we will see all the drugs that are included in pharmacology, or the drugs which we study in pharmacology. So the first one is the drugs acting on the autonomic nervous system, and this first group is the cholinergic drugs. These are also known as cholinomimetic or parasympathomimetic. So cholinergic agonists like acetylcholine, methacholine, carbachol, bethanicol, muscarine, pilocarpine and arecholine. Then there are anticholinesterases like reversible anticholinesterases are physostigmine and neostigmine like drugs, and irreversible anticholinesterases are carbaryl and propoxur, and organophosphate compounds like diplos, ecothiopate, malathion, diazinon, tabune, serine and soman. So these are all the cholinergic drugs. Now next is anticholinergic drugs. These drugs are also known as muscarinic antagonists, atropinic drugs or parasympatholytics. So these are atropine and hyoscine are natural alkaloids. Atropine methonitrate, homatropine, hyoscine butyl bromide, ipratropium bromide and tiotropium bromide, these are the semi-synthetic derivatives. There are various synthetic compounds like cyclopentolate and tropicamide. We use them as mydriatics. Oxybutynin, thioxate and tolterodine, these are the psychoselective drugs. Then trihexyphenidyl, procyclidine and bipyridine, these are the anti-Parkinsonian drugs. The anti-secretory, antispasmodic compounds are propanthelin, oxyphenonium, clydinium, glycopyrrolate, dicyclomine, valethamate and pyrinsepine. So these are all the anticholinergic drugs. Now next is the ganglionic stimulants and blockers. So the selective nicotinic agonists are nicotine in small dose, lobeline, dimethylphenyl, piperazinium, tetramethyl ammonium and varenicillin. The non-selective or the muscarinic agonists are acetylcholine, carbachol, pilocarpine, anticholinesterases and MCN 343A. Now coming to blockers, the competitive blockers are quaternary ammonium compounds like hexamethonium and pentolinium, amines like mecamylamine and pempidine, and trimethaphan camphor sulfonate, this is a monosulfonium compound. And the persistent depolarizing blockers are nicotine and anticholinesterases in large doses. In small dose they act as stimulants. So this was cholinergic drugs. Now the next is adrenergic drugs or the sympathomimetics. So this classification is based on their use. So the pressor agents are noradrenaline, ephedrine, dopamine, phenylephrine, methoxamine and phentermine. The cardiac stimulants are adrenaline, isoprenaline and dobutamine. Bronchodilator group of drugs are isoprenaline, salbutamol, terbutalin, salmeterol, formoterol and bambuterol. Now there are nasal decongestants like xylometazoline, oxymetazoline, nafazoline, phenylephrine, phenylpropanolamine and pseudoephedrine. The CNS stimulants are amphetamine, dexamphetamine, methamphetamine and methylphenidate. Ritodrine, isoxaprine, salbutamol, terbutalin, they also act as uterine relaxants. And amphetamine, fenfluramine, dexfenfluramine and sibutramine, these are the anorectics. Now next is the alpha adrenergic blocking drugs. So these drugs specifically block the alpha receptors. So there are two types, again non-equilibrium type and equilibrium type, that is competitive antagonists. So in non-competitive or non-equilibrium type there is only one drug, phenoxybenzamine. Now the equilibrium type is further classified into selective and non-selective. The alpha 1 selectives are frazocin, terazosin, doxazocin, alfuzosin and tamsulosin, whereas yohimbine is a alpha 2 selective blocker. The non-selective ones are ergotamine, ergotoxin, phentolamine, chlorpromazine, dihydroergotamine and dihydroergotoxin. It is also known as codargocrin. So ergot alkaloids are commonly non-selective alpha blockers. Now the next one is the beta blockers. So in beta blocker group of drugs, again these are classified into beta 1 selective and beta 1 beta 2 non-selective. The beta 1 selective drugs are metoprolol, atenolol, acebutolol, bisoprolol, ismolol, betazolol, celiprolol and nebivolol. The non-selective ones are the drugs without intrinsic sympathomimetic activity are propranolol, sotalol and timolol, whereas pindolol is with intrinsic sympathomimetic activity. And labetalol, carvedilol, these are having the alpha blocking property in addition to beta blocking action. So these can also be classified depending on their generation. First generation are non-selective, second one are the cardioselective, and third generation are the having alpha blocking property or the vasodilator property. So the third generation drugs are labetalol, carvedilol, celiprolol and nebivolol. Now there is one important condition which we study in autonomic nervous system, and that is glaucoma. So in glaucoma we commonly use the topical drugs, that is in the form of eye drops, and the drugs which we use are the first group is beta blockers like timolol, betazolol, levobunolol and cartiolol. The alpha adrenergic agonists are dipivefrin, apraclonidine and brimonidine. Prostaglandin analogs like latanoprost, travoprost, bimatoprost can also be used. Then carbonic anhydrase inhibitors like dorzolamide and brinzolamide. And miotics means parasympathomimetics like pilocarpine, physostigmine and ecothiopate. So these are all the topical drugs. Prostaglandin analogs and carbonic anhydrase inhibitors we will see in next classification. So coming to attacoids and related drugs. So these attacoids, first one is the histamine. So histamine agonists are histamine and beta histine. These are non-selective. Then selective H1 agonists are 2-methylhistamine, 2-pyridyl ethylamine and 2-thiazolil ethylamine. Selective H2 agonists are dimaprit and impromidine, and selective H3 agonists is alpha methylhistamine imitate. Now coming to H1 antagonists or H1 blockers, these are all conventional antihistaminics. So these are classified into 4 classes depending on their sedative property. The highly sedative ones are diphenhydramine, dimenhydrinate, promethazine and hydroxyzine. Pheniramine, cyproheptadine, meclozine and cinnarizine, these are moderately sedative, whereas chlorpheniramine, dexchlorpheniramine, triprolidine and clemastine, these are mildly sedative. And second generation are the non-sedative ones. Now the next attacoid is 5-hydroxytryptamine, also known as serotonin. So the antagonists of this serotonin are again various types. So the non-selective antagonists and partial agonists or antagonists. That means these drugs are agonist at some serotonin receptor and antagonist at some serotonin receptors. The examples are ergotamine, lysergic acid diethylamide, 2-bromo-LSD, methysergid, cyproheptadine and cinnarizine. These are the non-selective. The 5-HT2 antagonists are ketanserin, ritanserin, clozapine and risperidone. And the 5-HT3 antagonists are ondansetron, granisetron, tropisetron, palonosetron and ramosetron. So these are the selective 5-HT3 blockers. These we commonly use in the treatment of vomiting. Now another important condition that we usually study in the attacoids chapter is the migraine. So migraine, depending on the type of attack, we use different drugs. So to treat the attacks, we use simple analgesics like paracetamol, aspirin, metamizole and codeine. Then NSAIDs like ibuprofen, naproxen, diclofenac and mefenamic acid. Now to prevent the vomiting during the attack, we use antiemetics like metoclopramide, domperidone, prochlorperazine and promethazine. Ergot alkaloids like ergotamine and dihydroergotamine can also be used. And the selective 5-HT1B 1D agonists like sumatriptan, rizatriptan, naratriptan, zolmitriptan and provatriptan. To prevent the attacks, we use the propranolol-like drugs. Now the next one is the prostaglandins. So these prostaglandins are classified into two groups. One is the natural prostaglandins and another is the prostaglandin analogs or the synthetic ones. So the natural prostaglandins are dinoproston, which is a PGE2, gemiprost, dinoprost, which is PGF2 alpha, alprostadil, which is a PGE1, and prostacyclin, PGI2, also known as ipoprostenol. So these are the natural ones. And the prostaglandin analogs are carboprost, misoprostol, latanoprost, travoprost and bimatoprost. So these prostaglandin analogs we studied in glaucoma. So we can use them for the treatment of glaucoma topically. Now next group is the non-steroidal anti-inflammatory drugs, also known as NSAIDs. So non-selective COX inhibitors are aspirin, ibuprofen, naproxen, ketoprofen and flurbiprofen. Then mefenamic acid, piroxicam, tinoxicam, ketorolac, indomethacin, nabumeton, phenylbutazone and oxyphenbutazone. So these are the non-selective ones. The preferential COX-2 inhibitors are nimesulide, diclofenac, aceclofenac, meloxicam and etodolac. Selective COX-2 ones are inhibitors are celecoxib, etoricoxib and parecoxib. Now there are some drugs which are analgesic antipyretic but they have poor anti-inflammatory action like paracetamol, metamizole, propiphenazone and nifopam. So they don't inhibit COX. Now topical NSAIDs. Topical NSAIDs means the non-steroidal anti-inflammatory drugs that we use topically or externally to prevent the or to treat the pain. And the examples are diclofenac 1% gel, ibuprofen 10% gel, naproxen 10% gel, ketoprofen 2.5% gel, flurbiprofen 5% gel, nimesulide 1% gel and piroxicam 0.5% gel. So these topical NSAIDs come by various brand names like Volini gel or the diclofenac 1% gel, and Dolonex gel is there, which is the piroxicam 0.5% gel. So this was all about the topical non-steroidal anti-inflammatory drugs. Now apart from migraine, we study the rheumatoid arthritis and gout treatment. So the anti-rheumatoid drugs are divided into two types, that is DMARDs and adjuvant drugs. Adjuvant drugs are prednisolone and other glucocorticoids. And the disease modifying anti-rheumatoid drugs are of two types again, biological agents and non-biological drugs. The non-biological drugs are the immunosuppressants like methotrexate, azathioprine and cyclosporine, sulfasalazine, chloroquine, hydroxychloroquine and leflunomide. The biological agents are anakinra, which is interleukin 1 antagonist, and TNF alpha blockers like etanercept, infliximab and adalimumab. Now the next is the gout. In case of acute gout, we use NSAIDs, colchicine and glucocorticoids. For chronic gout or hyperuricemia, we use uricosuric drugs like probenecid and others. Now coming to drugs for cough. The pharyngeal demulcents are lozenges, syrups, glycerin and licorice. Expectorants, also known as the mucokinetics. So the mucolytics are bromhexine, ambroxol, acetylcysteine, carbocysteine. The secretion enhancers are potassium citrate, potassium iodide, guaifenesin, tolubalsam, Vasaka and ammonium chloride. Adjuvant antitussives are salbutamol and terbutalin, which are bronchodilators. And antitussives are the opioid group of drugs like codeine, ethyl morphine, pholcodine, non-opioids like noscapine, dextromethorphan and clofidinol. Antihistaminics, chlorpheniramine, diphenhydramine and promethazine. And pulmonary receptor desensitizer, these are the prenoxidazine. Now the important condition that we study in respiratory system is the bronchial asthma. So the drugs which we use in asthma are the bronchodilators like salbutamol, terbutalin, bombuterol, salmeterol, formoterol, methylxanthines like theophylline, aminophylline, codeine thiophylinate, hydroxyethyl theophylline, doxophylline, and the anticholinergics like ipratropium and tiotropium bromide. There are leukotriene antagonists like montelukast and zafirlukast, mast cell stabilizers like sodium chromoglycate and ketotifen. Omalizumab is a anti-IgE antibody, and the corticosteroids like systemic corticosteroids, hydrocortisone, prednisolone and other glucocorticoids. And there are some inhalational corticoids also like beclomethasone and budesonide, cyclesonide. Now the next system, the fourth system is the endocrine, and the first group is the anterior pituitary hormones. So from acidophil cells with the growth hormone and prolactin is secreted, and from basophil cells thyroid stimulating hormone, ACTH, FSH and LH are secreted. So the drugs which alter the anterior pituitary hormone secretion are, first is the drugs that inhibit GH release are the somatostatin, octreotide and lanreotide. Drugs that inhibit prolactin release are bromocriptine, cabergoline and apomorphine. Drugs which enhance prolactin release are chlorpromazine, metoclopramide and dizerpine. And there are some drugs which inhibit gonadotropin release. These are the ganirelix and citrorelix, which are antagonists of GnRH, and nafarelin, triptorelin, these are the superactive GnRH agonists. Now the next is thyroid gland. So thyroid is also important one. The thyroxine is T4 and triiodothyronine is T3 or leothyronine. So these are the main thyroid hormones. And the thyroid inhibitors or the antithyroid drugs are, first one is the drugs that inhibit hormone synthesis. These are commonly known as the antithyroid drugs. These are the propylthiouracil, methimazole and carbimazole. Now drugs that inhibit iodide trapping or ionic inhibitors, these are the thiocyanates, perchlorates and nitrates. In iodine and iodides of sodium, potassium and the organic iodide, these inhibit the hormone release. And the radioactive iodine, that is iodine 131, they destroy the thyroid tissue. So this can be used in the treatment of thyroid cancers. So this was about the thyroid gland. The next one is the insulins. So the rapid acting insulins or the insulin analogs are the insulin lispro, insulin aspart and insulin glulicin. The short acting insulin is the regular insulin, which is also a soluble insulin. Then insulin zinc suspension, neutral protamine, hegdon or isopen insulin. These are the intermediate acting. And the insulin glargine and insulin detemir, these are the long acting analogs of insulin. Okay. So insulin is a peptide. It is consists of a chain of amino acids, and we cannot take it orally because it is destroyed by the peptidase enzyme which are present in our GI tract. So we commonly use them by subcutaneous route. Now coming to anti-diabetic drugs which given by oral route. These are the drugs which enhance insulin secretion. These are the potassium ATP channel blockers, sulfonylureas like tolbutamide, glibenclamide, glipizide, gliclazide and glimepiride. Then repaglinide and nataglinide, these are the meglitinide group of drugs or phenylalanine analogs. Drugs which are used to overcome the insulin resistance are metformin and pioglitazone. And one insulin secretion is left, that is the DPP4 inhibitors. These are sitagliptin, vildagliptin, saxagliptin, alogliptin and linagliptin. And there are some miscellaneous group of drugs like acarbose, miglitol and oglibose, which are alpha glucosidase inhibitors, pramlintide, which is amylin analog, bromocriptine. These are the miscellaneous drugs. Now next is the corticosteroids. So the glucocorticoids, short acting glucocorticoid is hydrocortisone. The intermediate acting is prednisolone, methylprednisolone, triamcinolone and deflazacort. The long acting ones are dexamethasone and betamethasone. Mineralocorticoids are the aldosterone, fludrocortisone and DOCA, that is desoxycorticosterone acetate. And there are topical steroids also. The potent ones are beclomethasone dipropionate, betamethasone benzoate, betamethasone valerate, halcyonide, clobetasol propionate, fluocinolone acetonide, fluocortolone, triamcinolone acetonide and dexamethasone sodium phosphate. The mild ones are the hydrocortisone acetate 0.121% and hydrocortisone butyrate 0.001%. Now coming to next steroid, that is the testosterone. So the androgens are testosterone, dihydrotestosterone and androsterone. The synthetic ones are the methyl testosterone, fluoxymisterone and the misterilone. The anabolic steroids are the methandienone, nandrolone, phenylpropionate, nandrolone decanoate, oxymetholone and the stanozolol. The anti-androgens are the cyprotorone acetate, flutamide and bicalutamide. 5-alpha reductase inhibitors are the finasteride and dutasteride. Now drugs for erectile dysfunction. So the androgens like testosterone can be used. Phosphodiesterase 5 inhibitors like sildenafil, tadalafil and vardenafil. And intracavernosal therapy can also be used. Now next is the estrogens or the female sex hormone. These are the estradiol, estrone and estriol. These are the natural ones. Synthetic ones are the ethyl estradiol, mestranol and tibolone. The non-steroidal ones are diethyl silbestrol, hexastrol and dinestrol. Anti-estrogen is clomiphene citrate. Then selective estrogen receptor downregulator is fulvestrant. Selective estrogen receptor modulators, these are the tamoxifen citrate, toremifene and raloxifene. Then aromatase inhibitors are the letrozole, anastrozole and exemestane. So these are the drugs which affect the female, the estrogen, that is the female sex hormone. Now next is progesterone. The progesterone derivatives are medroxyprogesterone acetate, megestrol acetate, dihydrogesterone, hydroxyprogesterone caproate, and the normegestrol acetate. Then there are 19 nortestosterone derivatives like norethindrone, linestrenol, allylestrenol. And the gonanes are the levonorgestrel, desogestrel, norgestimate, and gestodin. The antiprogestin is mifepristone, and the selective progesterone receptor modulator, that is the ulipristal. This ulipristal is commonly used in the prevention of pregnancy. So the combined oral pills we commonly use for the contraception, and the hormonal contraceptives can be oral and injectable. The oral ones are the combined pills like norgestrel 0.5 mg plus ethinyl estradiol 50 microgram. Another combination is levonorgestrel 0.1 to 0.25 mg plus ethinyl estradiol 20 to 50 microgram. And the third one is the desogestrel and ethinyl estradiol. Then phased pills can also be used like levonorgestrel and ethinyl estradiol combination. 50 microgram, 75 microgram, 125 microgram of levonorgestrel and 30, 40, 30 microgram of ethinyl estradiol. Another is the norethindrone and ethinyl estradiol. So these are the phased ones. And postcoital pills are the levonorgestrel 1.5 mg, levonorgestrel 0.5 mg plus ethinyl estradiol 100 microgram, 2 doses. Injectable ones are the DMPA. Now coming to uterine stimulants and uterine relaxants. Oxytocics, the drugs which contract the uterus or stimulate the uterus, these are the oxytocin, desamino-oxytocin. Then again ergot alkaloids like ergometrin and methyl ergometrin. Prostaglandins also stimulate the which stimulate the uterus are PGE2, that is dinoprostone, PGF2 alpha, that is dinoprost, 15 methyl PGF2 alpha, that is carboprost, and the misoprostol or the plus mifepristone. In miscellaneous drugs are ethacridine and quinine. Now tocolytics or drugs which relax the uterus are the adrenergic agonists like ritodrine, salbutamol, terbutaline, and isoxaprine. The calcium channel blockers like nifedipine and other dihydropyridines. Oxytocin antagonist like atosiban, and the miscellaneous drugs like magnesium sulfate. Now the next system is the peripheral nervous system, and the main group of this system is the skeletal muscle relaxants, peripherally acting and centrally acting. The peripherally acting ones are the neuromuscular blocking agents. These are further classified into competitive blockers and the depolarizing blockers. The competitive blockers are the D-tubocurarine, pancuronium, doxycuronium, and pipecuronium. The intermediate acting ones are the vecuronium, atracurium, cisatracurium, rocuronium, and rapacuronium, and the mevacurium is the shortest acting one. The depolarizing blockers are succinylcholine and decamethonium. And there is direct acting, peripherally acting skeletal muscle relaxant is dantrolene, sodium, and quinine. Now centrally acting ones are the carisoprodol, chlorzoxazone, then diazepam, baclofen, thiocolchicoside. So these are the skeletal muscle relaxants. Now next is the local anesthetics. Local anesthetics are again of two types, injectable and the surface acting or the locally topical acting anesthetics. The injectable ones are the procaine, chlorprocaine, lignocaine, prilocaine, tetracaine, bupivacaine, ropivacaine, and dibucaine. So they all end in cane. The surface anesthetics are soluble ones are the cocaine, lignocaine, tetracaine and proparacaine. The insoluble ones are the benzocaine, butyl aminobenzoate and oxythazine. So these surface anesthetics commonly used in the treatment of mouth ulcers. In various mouth ulcer gels, these are the constituents: oxythazine and benzocaine. Now the sixth system is the central nervous system, and there are various drugs that act on this system. The first one is the general anesthetics. General anesthetics, depending on the route, this can be inhalational and intravenous. The inhalational ones are the nitrous oxide, the ether, halothane, isoflurane, desflurane and sevoflurane. Then intravenous drugs are the first one is the fast acting. These are the thiopentone, methoxytone and propofol and etomidate. The slower acting drugs are the benzodiazepine group of drugs like diazepam, lorazepam and midazolam, fentanyl, which is an opioid analgesic, and ketamine. Ketamine produces dissociative anesthesia, so it is a dissociative anesthetic. So these are the general anesthetics which we commonly use during the major surgeries. For minor surgeries, we use the local anesthetics. So the next is the pre-anesthetic medication drugs. These are the diazepam, lorazepam, promethazine, then morphine, pethidine, atropine, hyoscine, glycopyrrolate, which are the anticholinergic drugs, chlorpromazine, triflupromazine, haloperidol. These are the neuroleptics. Then antiemetics like metoclopramide, domperidone, ondansetron. And gastric acid suppressant drugs like ranitidine, famotidine, omeprazole and pantoprazole. So these drugs commonly we use before giving the anesthesia to the patient for major surgeries. So these are used to alleviate the anxiety of the patient and to prevent other complications, like to decrease the secretion. Now next group is the sedative hypnotic group of drugs. So the benzodiazepines like diazepam, flurazepam, nitrazepam, alprazolam, timazepam and triazolam. Other anti-anxiety and benzodiazepines are diazepam, chlordiazepoxide, oxazepam, lorazepam and alprazolam. Diazepam, lorazepam, clonazepam and clobazam, these are the anticonvulsant benzodiazepines. Now non-benzodiazepines are the zopiclone, isopiclone, zolpidem and zaleplon. Barbiturates, these are the phenobarbital, butobarbital, pentobarbital, thiopentone and methoxytone. The other CNS suppressants that are used as sedative hypnotic are the chloral hydrate, triclopos, paraldehyde, glutathione, promethazine, chlorpromazine, amitriptyline and morphine. Now the next one is the anti-epileptic drugs. So these are used in the treatment of various types of seizures. So first one is the phenobarbital, another is phenytoin, fosphenytoin, then ethosuximide. Benzodiazepines can be used like clonazepam, diazepam, lorazepam and clobazam. And other drugs are primidone, carbamazepine, oxcarbazepine, valproate, divalproex, lamotrigine, gabapentin and pregabalin. And the newer drugs are topiramate, zonisamide, levetiracetam, vigabatrin, tiagabine and lacosamide. So these are the anti-epileptic drugs. So barbiturates, benzodiazepines, GABA analogs, these are the some broader groups, and others are the smaller ones. Now one important condition that we study in CNS is the Parkinsonism. So the drugs which are used in the treatment of Parkinsonism are drugs which affect the brain dopaminergic system. These are levodopa, carbidopa, benzodiazide, bromocriptine, ropinirole, pramipixole, selegiline, rasagiline, entacapone, tolcapone, and amantadine. And the drugs that inhibit the brain cholinergic system are central anticholinergics like trihexyphenidyl, procyclidine, piperidine, and the antihistaminic group of drugs like orphenadrine and promethazine. So drugs affecting cholinergic system, we have seen them in autonomic nervous system, right? And antihistaminics we studied in atocoid chapter. And these drugs which affect the brain dopaminergic system we are studying here. Now the next is antipsychotic drugs or the neuroleptic drugs. These drugs we used in the treatment of schizophrenia or other types of psychosis. So these drugs are phenothiazines like chlorpromazine, triflupromazine, thioridazine, trifluoperazine, and fluphenazine. The butyrophenones are haloperidol, trifluperidol, and penfluridol. Fluphenthixol is a thioxanthine group of neuroleptic drug, pimozide and loxapine. Now important group is atypical antipsychotics, and the drugs are clozapine, risperidone, olanzapine, quetiapine, aripiprazole, ziprasidone, amisulpiride, and zotapine. So these are the various antipsychotic drugs that we use in the treatment of schizophrenia. Now the next is the drugs used in the treatment of mania and bipolar disorder. These are lithium carbonate, the anti-epileptic or anticonvulsants like sodium valproate, carbamazepine, and lamotrigine. The atypical antipsychotics that we use in the treatment of this condition are olanzapine, risperidone, quetiapine, and aripiprazole. Now the another classification is of hallucinogens or the drugs which are psychotomimetics. These are lysergic acid, psilocybin, harmine, then phenylalkylamines like mescaline, ecstasy, and yaba. Then phencyclidine is a aryl cyclohexylamine, and THC, that is tetrahydrocannabinol. It's a cannabinoid group of drug. So these are all hallucinogens, also known as psychedelics or the now next is the antidepressants. These antidepressants are used in the treatment of depression. So first one is the REMAs, that is reversible inhibitors of MAO-A, and that is moclobemide and clorgeline. The SSRIs are fluoxetine, fluoxamine, paroxetine, sertraline, citalopram, escitalopram, and dapoxetine. The tricyclic antidepressants are imipramine, amitriptyline, trimipramine, doxepin, dothepin, and clomipramine. The predominantly noradrenaline reuptake inhibitors are desipramine, nortriptyline, amoxapine, and ribozetine. Then SNRIs are venlafaxine and duloxetine. The atypical antidepressants are trazodone, meancerin, mirtazapine, bupropion, tianeptine, amineptine, and the atomoxetine. Now another important condition that is anxiety. So anxiety is also a type of neurotic disorder where patient is aware of its symptoms, and the drugs are the benzodiazepine group of drugs like diazepam, oxazepam, lorazepam, chlordiazepoxide, and alprazolam. Then azapirones like buspirone, gepirone, and ispapirone can also be used. Sedative antihistaminic drug is hydroxyzine, and propranolol, it is a beta blocker which is used in the treatment of performance anxiety. So these are all the anti-anxiety drugs. Hydroxyzine is a first generation antihistaminic, which we seen during the atopic chapter. This is a first generation, that is mean it is highly sedative. Now the next is opioid analgesics and antagonists. So opioid mu receptor agonists are morphine, codeine, diacetyl morphine, folcodine, ethyl morphine, pethidine, methadone, fentanyl, dextropropoxyphene and tramadol. Then nalorphine, pentazocine and butorphanol, these are the complex action opioids. These are the kappa analgesics. Then buprenorphine is a partial mu agonist plus kappa antagonist. And pure opioid antagonists are naloxone, naltrexone and nalmefene. So these are commonly used during the de-addiction of the opioids, the antagonists like naloxone. So these are the opioid group of drugs. These are commonly used in the treatment of severe pain. Now coming to CNS stimulants, the convulsants are the strychnine, picrotoxin, bicuculin and pentylene tetrazole. Then doxapram is an analeptic group of drug. Psychostimulants like amphetamines, methylphenidate, atomoxetine, modafinil, armodafinil, pimoline, cocaine and caffeine. So these are the CNS stimulants. The cognition enhancers or the cerebroactive drugs are rivastigmine, donepezil, galantamine and tacrine. Then NMDA antagonist is memantine. And the other miscellaneous drugs are piracetam, pyretinol, dihydroergotoxin, ceticoline, piribedil and the ginkgo biloba. So these drugs enhance the memory, enhance the cognitive power. Now the next system, the seventh system, is the cardiovascular, and the important condition is the hypertension. So the drugs used for the treatment of hypertension are diuretics like hydrochlorothiazide, chlorthalidone, indapamide, furosemide, spironolactone, eplerenone and amiloride. The RAS inhibitors are the ACE inhibitors like captopril, enalapril, lisinopril, perindopril, ramipril, fosinopril, quinapril and trandolapril. The 81 blockers are losartan, candicertan, valsartan, telmisartan, irbesartan and olmesartan. And aliskiren is a direct renin inhibitor. Then sympathetic inhibitors are beta blockers like propranolol, metoprolol, atenolol, then labetalol and carvedilol. The alpha blockers like prazosin, terazosin, doxazosin, phentolamine and phenoxybenzamine, and the central sympatholytics like clonidine and methyldopa. So apart from that, other drugs that can be used in the treatment of hypertension are calcium channel blockers. These are verapamil, diltiazem and dihydropyridines like nifedipine, felodipine, amlodipine, nitrendipine, lacidipine, lercanidipine and benidipine. See all the dipines. These are the dihydropyridines. Another group is the vasodilators. Vasodilators like hydralazine, minoxidil and diazoxide. These are the arteriolar dilator. And the mixed dilators are nitroprusside sodium or the sodium nitroprusside. So they dilate both arteries and veins. So these are the vasodilator group of drugs. So these antihypertensive drugs can be remembered by the mnemonic ABCD. So C is the calcium channel blockers and D is the dilators or the diuretics. Now anti-anginal drugs. So angina pectoris is also one of the important condition that we study. So the nitrates, the short-acting nitrates are glyceryl trinitrate, isosorbide dinitrate. It is given by sublingual route. In long-acting ones are the isosorbide dinitrate by oral route, isosorbide mononitrate, erythritol tetranitrate, and pentaerythritol tetranitrate. Beta blockers. Here also we use propranolol, metoprolol, and atenolol. Calcium channel blockers like verapamil, deltazim, amlodipine, and nitrendipine, and others. Nicorandil is a newer drug which is a potassium channel opener, and the other anti-anginal drugs are trimetazidine, ranolazine, ivabradine, oxypedrin, and dipyridamole. So beta blockers and calcium channel blockers we already seen, right? The nitrates is a newer drug, newer group here. Now drugs for peripheral vascular disease. So there are some condition where there is vasoconstriction of our peripheral blood vessels. So in this condition we can use these agents. So the rheological agents are pentoxyphylline. Then PDE3 inhibitor is cilostazol. Antiplatelet drugs like aspirin, clopidogrel, and ticlopidine. Vitamin E, which is an antioxidant, can also be used for the PVD. And the vasodilators like cyclendilate, xanthinol, nicotinate, isoxapriline, prazosin, phenoxybenzamine, nifedipine, nitrendipine, and the PGI2 group of drugs. So these are the vasodilators used for the peripheral vascular disease. Now heart failure. So it is also one of the important condition. So in heart failure we use inotropic drugs like digoxin, cubane, dobutamine, dopamine, enamrenone, and milrinone. The RAS inhibitors like enalapril, ramipril, losartan, and candesartan can be used. Diuretics like furosemide, bumetanide, hydrochlorothiazide, metolazone, and zipamide. Vasodilators like glyceryl trinitrate, isosorbide dinitrate, hydralazine, and sodium nitroprusside. Beta blockers like metoprolol, bisoprolol, nebivolol, and carvedilol. And the aldosterone antagonists like spironolactone and iplerinone. So these are various group of drugs that can be used in the treatment of congestive heart failure. So diuretics, RAS inhibitors, then beta blockers we have seen already. Now coming to antiarrhythmic drugs. So these antiarrhythmic drugs are divided into 4 classes. So first class is the membrane stabilizing agents. These are the quinidine, procainamide, disopyramide, lignocaine, mexiletine, propafenone, and flecainide. The class 2 are the beta blockers like propranolol, sotalol, and ismolol. The class 3 are the agents which widen the action potential or the potassium channel blockers. These are the amiodarone, dronedarone, dofetilide, and ibutylide. And the class 4 ones are the calcium channel blockers. And only 2 are there, verapamil and deltazim. The dipine group of drugs we don't use them as a antiarrhythmic agent. Then drugs for PSVT. Now the next important system is the kidney. Okay, so drugs acting on kidney. So first is the diuretics. The high ceiling ones are the furosemide, bumetanide, and torsemide. In medium efficacy ones are hydrochlorothiazide, hydroflumethiazide, benzthiazide. Thiazide like group drugs are chlorthalidone, metolazone, zipamide, indapamide, and clopamide. The weak diuretics are acetazolamide, mannitol, isosorbide, and the glycerol. The potassium sparing diuretics are aldosterone antagonists like spironolactone, iplerinone, amiloride, and triamterene. So these 2 are ENaC inhibitors. Then antidiuretics are vasopressin, desmopressin, lepressin, terlipressin, and others. Now the next system is the drugs affecting blood. So first is iron. The oral irons are ferrous sulfate, ferrous fumarate, ferrous gluconate, ferrous succinate, ferrous aminoate, ferric ammonium citrate, ferric hydroxy polymaltose, carbonyl iron, and iron calcium complex. The parenteral irons are iron dextran, iron sorbitol citric acid, ferrous sucrose, and ferric carboxy maltose. The maturation factors are vitamin B12 like cyanocobalamin, hydroxycobalamin, methylcobalamin, and the folic acids like folinic acid, which is a leucovorin or cytovorin factor. And the adjuvant hematinics are copper, pyridoxine, and riboflavin. So these drugs commonly used in the blood formation. Now another is the coagulants, the drugs which coagulate the blood or cause the clotting of the blood. So these are vitamin K. The K1 is phytonadione or the phylloquinone, and the vitamin K3 is menadione, acetaminophen, menadiene sodium bisulfite, menadiene sodium diphosphate. The miscellaneous drugs are the fibrinogen, which is a human antihemophilic factor, desmopressin, adrenochrome, mono, semicarbazone, ethamsilate, and rutin. So these are the miscellaneous coagulant drugs. Now the next group is the anticoagulants. So anticoagulants are the drugs which prevent the clotting. So the parenteral ones are heparin, low molecular weight heparins, fondaparinux, and dinaparoid. Direct thrombin inhibitors are lepiridine, bivalirudin, and ergotroban. Then another group is the oral anticoagulants. These are dicumarol, warfarin sodium, alsinocomarol, and ethyl biscomacetate. Rivaroxaban is a direct factor 10A inhibitor. Then oral direct thrombin inhibitors. These are the dabigatran, etexilate. And there are some in vitro anticoagulants also, like heparin and sodium meditate, sodium citrate. Now the next is the fibrinolytics. Fibrinolytics or thrombolytics are kinases like streptokinase, urokinase, alteplase, retaplase, and tenecteplase. The antifibrinolytics or antithrombolytics are EACA, that is epsilon aminocapric acid, and tranexamic acid. The next important group is the antiplatelet drugs or the antithrombotic drugs. These are aspirin, dipridamole, ticlopidine, clopidogrel, prasugrel, apixaban, eptifibatide, and tirofiban. So this tirofiban is a GP2B3A antagonist. So this antiplatelet drugs are the very important one, and aspirin is also a group from NSAID, the NSAID drug. Now next is hypolipidemic drugs. So these hypolipidemic drugs are statins or the HMG CoA reductase inhibitors. These are lovastatin, simvastatin, pravastatin, atorvastatin, rosuvastatin, and pitavastatin. Then PPAR alpha activators, fibrates. These are clofibrate, gemfibrozil, bezafibrate, and fenofibrate. Sterol absorption inhibitor is ezetimibe. Then bile acid sequestrants are cholestyramine and cholestyramine. Lipolysis and triglyceride synthesis inhibitor is nicotinic acid. So these are the drugs which decrease the VLDL levels. Now the next important drug group from the blood system is, or the hematinic system is, plasma expanders. So these plasma expanders means these drugs increase the volume of the plasma, and the drugs are the human albumin, and the concentration is 5 to 20%, and it is commonly given by the IV infusion route. Then dextran 70, having molecular weight 70,000, and the preparation is 6%, which is also given by the IV infusion route. And the dextran 40 is also there, which is having molecular weight of 40,000, and it is a low molecular weight dextran. It is given by IV infusion route. Next is the polygelin. Now coming to the most important system, that is the gastrointestinal tract, and the important condition is the peptic ulcer. So there are various drugs which we use in the treatment of peptic ulcer. So the first one is the gastric acid secretion inhibitors like cimetidine, ranitidine, famotidine, roxetidine, omeprazole, esomeprazole, pantoprazole, lansoprazole, rabeprazole, dexrabeprazole, and misoprostol, and the anticholinergics like prinzepine, propanthelin, and oxypinonium. Then there are gastric acid neutralizers or antacids. These are sodium bicarbonate, sodium citrate, magnesium hydroxide, magnesium trisilicate, aluminum hydroxide, megaltrate, and calcium carbonate. Ulcer protectives are sucralfate, colloidal bismuth, subcitrate, and the anti-H. pylori drugs like amoxicillin, clarithromycin, tinidazole, and metronidazole. Now important condition in GI system is the vomiting, and the drugs used in the treatment of vomiting are known as the antiemetic drugs. These are the hyoscine, dicyclomine, chlorpromazine, triflupromazine, and chlorpromazine. The H1 blockers are promethazine, diphenhydramine, thiaminhydrinate, oxylamine, and meclizine. The prokinetics are metoclopramide, domperidone, cisapride, musapride, and etopride. The NK1 receptor antagonists are aprepitant and fosaprepitant. The 5-HT3 blockers are ondansetron, granisetron, palonosetron, and ramosetron. The adjuvant antiemetics that are used in the treatment of vomiting are dexamethasone, benzodiazepines, dronabinol, and nabilone. So these are all the antiemetic group of drugs. Now the third condition is the constipation and diarrhea. So the laxatives are used in the treatment of constipation. These are also known as purgatives and cathartics. The bulk forming agents are dietary fiber like bran, psyllium or plantago, isabgol, and methylcellulose. Stool softeners are docusets and liquid paraffin. The osmotic purgatives are magnesium sulfate, magnesium hydroxide, sodium sulfate, sodium phosphate, and sodium potassium tartarate, and the last one is the lactulose. The stimulant purgatives are phenolphthalein, bisacodyl, sodium picosulfate, senna, cascara sagrada, prucalopride, and castor oil. So these are the purgatives which we use in the treatment of constipation. Next one is the drugs for diarrhea. So first group is the antimicrobial drugs like norfloxacin, ciprofloxacin, rifaximin, cotrimoxazole, ampicillin, tetracycline, erythromycin, metronidazole. Probiotics like lactobacillus species, bifidobacterium, bifidium, streptococcus faecalis, enterococcus species, bacillus clausi, and saccharomyces boulardii. The non-specific antidiarrheal drugs are isabgol, methylcellulose, kaolin, and pectin. Antisecretory drugs are racecadotril, bismuth subsalicylate, anticholinergics, and octreotide. Antimotility drugs are codeine, diphenoxylate, and loperamide. Then drugs for inflammatory bowel disease are sulfasalazine, mesalazine, balsalazine, olsalazine, prednisolone, and hydrocortisone. These are the glucocorticoids. And immunosuppressants like azathioprine, methotrexate, cyclosporin, and infliximab.